camera's not here, it's just you and Brett having
Okay.
a conversation, so ignore us.
They might float out some questions or ask you to build upon an idea, but answer it to me like it's something I asked. We're
Okay.
just trying to maintain the iPad.
Okay.
Phone's off, just making sure that.
Yeah.
I left my phone in the other room,
You're
so.
pro.
Okay, the truck's getting ready to rev up out there.
Yeah, right. You're not picking up any of that refrigerator that I hear humming?
You know, it's well within Corbin's level of,
Yeah.
Tolerance.
No,
Good deal.
I don't know what he does with it, but it all disappears.
He makes magic happen.
Yeah.
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 So how have your first since you've been here on the 20th, how has the time been getting acclimated to the area, the practice?
So far things have been going really well. I think I've gotten used to, the record system and just kind of getting used to the area itself. My husband and I have done a little bit of exploring, but not a ton yet, so we've had a lot of housework to do.
Yeah.
Yeah,
Keep you busy, I'm sure.
definitely.
Yeah. So you're seeing 3 patients a day? Is that what it was?
Every day is a little bit different.
Okay.
Some days I see 3, some days I have 6, which right now is a full schedule for me. I'm hoping to kind of tail down and start seeing more people eventually here in the next couple of weeks. So I think so far things are going well with that.
Good. So describe meeting with a patient for the first time and the relationship you try to build with them.
When I meet somebody for the first time in the clinical setting, I try to just make them feel at ease. I try to get to know them. I mean, the whole point behind this relationship is that we can start building those blocks to, form a really tight, close-knit patient-physician relationship. And that's the more important part of my job, I think, is to make my patients feel comfortable, feel at home, feel like, we're moving towards being friends or family, and it's the idea behind family practice in my mind.
Yeah, I'll speak to that. That's great. I mean, family practice, you take care of a family, but you're also a part of it in some ways. So maybe talk to that a little bit.
Sure. So in family practice, I was kind of drawn to that because I can see a whole family. I enjoy seeing all ages, both young and old, and working with people through the difficulties and challenges and good moments of, their different points in life. I really enjoy when I actually get to see a whole family because I think that's really cool to kind of get to know everybody in the family and get to help them with what they need help with.
Does having a firm understanding of the entire family help you to treat a particular person because you have a background with the rest of everybody?
I think having that background with each family does help me treat patients better. Just because you know what their support system is like, what their family is able to provide for them, and having a good support system is also important in having good health.
Do you incorporate the family? So yeah, maybe let's talk about that some more. You can help a patient and tell them to do A, B, and C, but how do you involve the entire family in their health plan?
When trying to get somebody to get extra support from their family, sometimes it's helpful to have the family come in, especially if they're struggling with something in particular, to, that way there's more people that know what they need to do, and that gives them more motivation, more checkpoints to get themselves to the best them, and to the best level of their health.
I like that. I like that, the best them. Could you say that again? I try to get people to, or along that idea, I try to get people to be the best that they can be. Something along those lines, like that's your goal when you treat them?
Sure. So my goal for patients when I see them is try to help them work towards being the best form of themselves.
So how do you portray to your patients that you care about them?
In this day and age, it's really hard because we have computers. And so I think it's a balance that you have to form. You need to be doing your documentation, but you also need to be paying attention to the patient. So I've tried to become pretty good at multitasking and actually looking at my patient and giving them the eye contact that they deserve and need. And if they're struggling with something, offering them something simple as a tissue or, a healing touch or anything of that nature can be really helpful to kind of make that bond stronger.
Yeah, how important is that bond in the treatment process?
I think the bond between a physician and a patient is huge. If you don't have trust mutual between the two of you, you're not going to have a healing relationship. And so that's the point of every appointment you have, is to continue to strengthen that relationship and continue to strengthen that bond.
That's awesome. Could you describe
You're doing a great job, by the way. I just want you to know that.
Well, that's good.
Yeah. These
Perfect
answers are
sound
quick.
bites.
I'm a hand talker, so I
You can talk
apologize.
your hands.
Please,
Okay.
yeah, you're okay.
Okay. I'm like, I don't want to
No, you can
get all crazy over here.
Oh, you're right.
We
Okay.
like a little bit of crazy, so.
That's good.
But yeah, I'm in my head. I'm like checking out that one's gonna work. All right, that one will play in the video. All right, good job. Usually it takes some kneading before we get some good ones, so this is awesome. So maybe you could describe your bedside manner with your patients.
No. So my bedside manner, I think, it depends on the patient. You kind of have to meld yourself into what they need. So sometimes people need a little bit more of a push, and they need a cheerleader at times. And some people just, need somebody to hold their hand a little bit, but not too much. It just kind of depends on what their needs are. And I think you figure that out after a few appointments with them and what style works best for them. So I kind of feel like I'm a little bit of a chameleon in that aspect.
Are you sensitive to your patient's needs?
I am sensitive to my patients' needs.
You adapt for them.
I do. Yeah, I do try to adapt for my patients because I think it's important. And again, that builds on that patient-physician relationship. If you don't adapt to what they need, they're not going to feel comfortable with your interactions. They're not going to feel trusting of you. And so the more you work with them, the more you tailor your style to them, the better outcome that I think you get.
Oh, what steps do you take to make an accurate diagnosis or health plan for your patient?
When I'm trying to figure out what's going on with a patient from a health standpoint and we're kind of stumped, I rely on looking into the research and the evidence and what the best type of workup is. I try to make sure that we don't leave any rock unturned. We need to figure out what's going on to help the patient get better and feel better, or at least get moving in the right direction. So I try to go about it in a very systematic fashion. I don't want to unburden people with all this cost of medicine and stuff. So I try to just sort of pick away at it over time, but in a timely as possible manner, so that way we can get to the bottom of what's going on.
So efficient, but simple and easy to digest from the patient's perspective.
Yeah, I think I try to work with the patient when figuring out what's going on with their health in an easy manner, but both financially and in a way for them to understand, but also quickly enough to where we know that we're getting to the job done that needs to be done.
When a patient leaves your office, how do they feel?
I hope when patients leave my office, they feel good about what they've, encountered, and they feel comfortable with me. My goal is to make them feel like they're my family,
What do they tell their friends about their experience they had with you?
That's a good question. I think patients, when they, get out of my office, they hopefully feel comfortable with sharing with their friends that I'm somebody they can come see. I know there aren't very many female providers out here in Lewiston, and so I think that's gonna be a big driving factor for a lot of people to come out and visit with me and hopefully get some help from me, and yeah.
Yeah, of course. Why did you decide to get into family practice?
I chose family practice as a specialty because I enjoy seeing everyone, the young, the old. I enjoy the challenges that come with it. You know, it's a very broad spectrum specialty, and so you have to know a little bit of everything. And I enjoy that you can, you know, see the really physically well, but also help people with their chronic medical illnesses, their psychiatric illnesses, and you can mix it up a little bit with some procedures that are easy to provide for the patient. It's a lot of variety, it's a lot of challenge, and it's something that I love, so.
What's the best part of taking care of families?
I think the best part of taking care of families is just getting to know them and hopefully becoming part of their family in a way. You really get a better understanding of someone when you get to know multiple people in their support system.
So what do patients think are your best personality traits?
All these hard questions. I would say that patients
It's hard to talk about yourself.
it is. I hate talking about myself.
Yeah, you at that, right? Yeah, exactly. Your smile, your laugh, you're disarming, right? You're a trustworthy person, and you're just an ear for them. Don't be afraid to be proud of yourself and speak highly of yourself here. It's okay. I know it's uncomfortable. I can't do it either, but for the purposes of the video, you can be a little proud.
Okay.
Yeah. So I'll ask it again. but,
Okay.
So what do you think what do your patients think are your best personality traits?
I think my best personality traits are that I come off as trusting. I'm willing to have a little bit of fun during my appointments. I put people at ease.
Are you relatable?
I think I'm relatable. Yes.
Yeah, that's a tough one. It's always a tough one. I'll move on.
I hope so.
So what are the benefits of having a family practice in Lewiston?
So I think the benefits of having a family practice in Lewiston is there are a lot of people out this way that don't have a doctor. It's a very high area of need. And a lot of people travel really far to see a family practice provider. And having somebody to kind of be your one-stop shop for all of you and all of your health, both mental and physical, is really important. Because that helps coordinate your care. It helps make sure that you're getting the services that you need, that you deserve, without having to make you drive forever to get there.
Yes, we are in the middle of not the middle of nowhere, but we're in a spot that may be far away from the larger systems. What benefits do you see being related to OMH? What services can you pull from and draw from that make this a unique situation for you?
I think being relatively close to the bigger part of OMH and Munson is really helpful in the fact that we can get access to those specialties that we need. We can get patients the more detailed help that they have to get for their health. It just really helps improve the access to those different services that we can't provide out here. And we try to do as much as we can, but when we reach our limit of our knowledge, of our specialty, we have the net of being able to send patients out into the greater Munson and OMH system to get them all the services that they deserve.
So that's a good point, though. There are a lot of services available right here under this roof. How does that make you feel? What does that mean for the patients? And maybe speak to those services.
Sure. So when I first joined this clinic in Lewiston, I was really jazzed to find out that we have bone density scanning, we have mammogram available here, we can do x-rays, we can do ultrasounds, we have a diabetic educator that comes out. We have all these great services that come to us, so that way we don't have to make our patients travel, because even though Gaylord isn't that far away, it still can be a burden to a lot of people, especially when they may be traveling 20, 30 minutes to come see me, or 20, 30 miles even to come see me. So the fact that they can come here and they can get everything done at once, I think is awesome.
It's probably a little early, but have you bumped into any of your patients out in the wild?
No, I don't think so.
Yeah.
I haven't run into anybody yet.
Yeah.
It will happen.
Yeah.
That's part of why I like a small community, is you kind of see your patients out in the woodwork and you kind of get a little bit better feel for, are they actually listening to you or not? But it's also just nice to see them in a not so rigid setting in some ways.
Does it excite you to be a part of a community and to be able to assist and help in the healthcare of the community?
Yeah, I love the idea of being a part of a smaller community. I think I came from a little bit bigger of a place, and so it required, I think, less effort to get people the care that they needed because it was there. And so being in an area like Lewiston is great because I can kind of be that gatekeeper for patients to help them find the services they need, try to find them the resources they need. And I think being integrated into that community it's a good feeling. You really do feel like you're making an impact.
Do we pick any background up on that?
I think Glenn was fine.
One of those little beeps, those are wherever they
Yeah.
are,
So what do you do to show your patient that you go above and beyond for them?
So I try to show my patients that I go above and beyond for them when I just spend the time with them. You really need to put time and effort into it. If that means giving them a phone call, making some changes with their medications, or ordering things, or getting some services rolling over the phone instead of making them come in. That's what I do. I have to sometimes spend a little more time with people, and if I need to get behind with my day, then I will. Yeah.
Can you just take that question one more time? I just looking for a concise statement about time.
About time?
Yeah.
Spending time.
Yeah,
with them?
you said it, but I just want a little bit shorter.
Sure.
Yeah.
You want me to ask
And
you
there were
that?
some beeps in there.
Yeah, that's fair. Yeah.
How do you show your patients that you go above and beyond for them?
So I try to go above and beyond for my patients by giving them the time that they need, whether it's spending some time on the phone, making adjustments with meds, or ordering things for them, or just spending more time with them in the appointment, even though it might make me get behind. That's what I do. I try to spend the time that they need.
Want to do one more? We can shorten that.
Even shorter.
Yeah. So you qualified it a couple times, but we'll just get that one delivery, that initial delivery.
Okay.
So one more time. So how do you show your patients that you go above and beyond for them?
I try to go above and beyond for my patients by just spending the extra time that they need with them, whether it's on the phone or in the appointment, and just making sure it gets done.
That was great.
Yeah, it
Okay.
was. So how does it make you feel to know that the advice and the help you give a patient is taken to heart and they make positive changes to their lifestyle?
So I think it's a great feeling when patients actually listen to you. They take what you advise to them and they make changes in their lifestyle, or, I don't not just changes in their lifestyle, but I don't know.
They make a turn. They take what your health plan that you put together for them, and they make it turn for the better. And now they're healthier, they're living better. And how does that make you feel knowing that you were a part of that?
I get excited when patients actually, listen to me, to their health plan, to get themselves better, whether it's mentally, physically, both. The fact that they can sort of take my advice to heart and make themselves a better version of themselves is just a great feeling. Gives you the warm and fuzzies.
Do you have any stories about how a patient came back and were able to tell you that they've made a change, they've improved their lives? What was their response to your health planning?
So I think some of the more rewarding situations I've come across in the past is when patients come in. I do a lot of depression and anxiety and mental health management, and that's kind of a passion of mine. And when somebody comes back who's been, hiding in their house because they can't work up the courage to get outside because they're afraid, and they come back in and they see me and they're just happy and interacting more comfortably and just overall looking and feeling better, that to me is a great thing.
It's got to be incredibly rewarding.
Definitely very rewarding. I think it's amazing to see that you can make even a small impact on somebody's life and make them feel better, make them feel more able to, get out in the world and do things.
You only see these people for 15, 20 minutes, but what they do to change their lives lasts much longer. It's a much bigger impact in that small amount of time that you have with them. How rewarding is it to see that this small minute, this small break you have with this person to get their story and develop this plan for them, and see them run off and go off and live life to its fullest.
It's an incredible thing to see when somebody, takes those few minutes that we have together and really makes a change in their life. And sometimes it doesn't feel like enough time that we get to spend with them, but when somebody comes back to see me the next time and they've made these massive changes in their life and they're just doing better from a health and mental wellness standpoint, it's awesome.
What do you love about your job?
I love a lot of things about my job. I love the variety. I love the people and the patients I get to see, the people I get to work with. I love the intellectual challenge of it. I think family medicine provides me with so many different ways to challenge myself. I love the hands-on nature of my job. Yeah.
That's interesting to me. I asked you about what was it? What are your best personality traits? And you're like, oh, I can't do this. But I asked you what you love, and you're like, here's my list. I got 47 other things here. That's awesome.
I don't know. I enjoy my job. I think it's fun. Yeah.
That's a good deal. Do you guys have anything you want to add?
Yeah, that was a beautiful interview, beautiful job there. I was wondering if it would help, because I didn't think she did a real good job boasting herself. So what do your patients tell you about, some of your better qualities? Is there any? I know that might not have happened a lot either, but things you've been told?
Things I've been told by
Yeah,
patients.
my patients tell me
So my patients in the past have told me,
We start over.
yeah, no, that's fine.
Sorry.
No, that's okay. I'm trying to think. I don't know.
Yeah, and maybe it doesn't work that way, but that was the only area that I thought that was just love to hear you say a few more things about yourself, but maybe through your patients' words, if there are.
You can be funny too.
Okay.
You don't have to be completely serious.
I have no idea. I don't know. Thinking.
Do they tell you that you're sensitive to their needs? Do they tell you you're some of those things Travis?
I know they usually tell me that they love my hair.
Let's go with that. Let's start with that.
uh, I do. They're usually like, I'm jealous of your hair. I'm like, okay, thank you. hmm. Yeah.
Can you think of a particular patient or experience and speak to that about a wonderful success story that they had?
Oh, yeah. I'm trying to think if
How about
there's
this? Tell me about the hugs you get.
the hugs. I had a lot of hugs when I left my job before. People were really sad that I was leaving. Some of them were bawling their eyes out before I left because they didn't want me to leave.
Are you looking forward to more hugs while you're here?
Yeah, as long as it's not a stinky patient, I'm okay with hugs.
That soundbite will make the video.
Oh, goodness. I don't know. Trying to think of what things patients have told me before.
It doesn't have to be a monumentous thing.
We're good.
What's that?
You've done a great job.
Yeah, you did a really great
Like
job.
standard
Yeah.
Oh, yeah.
Are you good with everything? Do you have anything on it?
She has some good stuff in there.
Actually, very beautiful interview.
Well, that's good. Glad I could be of service.
Hard part's over? Oh no, second to last.
Uh-oh, there's more?
Yeah.
Oh,
Yeah.
You
Trick
lied to
questions.
me.
Here come the trick questions.
This one will break you.
This one will break me.
Yeah. We do this.
I don't
We do
know.
this after
It's
the
okay.
interview, so you don't hate me. That's a mouthful, and it's worse now that we're months in healthcare.
Oh, yeah, that makes it so much longer. It really does.
We knew it was coming. We knew it was
Oh,
coming.
boy.
So you can look directly at the camera here.
Okay.
I gotta have you paper down a little bit lower.
A little lower. Yeah, the paper.
Oh, the paper. Sorry.
You can sit back up.
We could say this as many times as you want.
'Kay.
Practice it.
She's got it.
Mess it up. But
I probably will mess it up because this is, like, horrible to say.
and if you want, I can. You can come in. No, you can come in.
Dr. Russo. I saw him, like, stare in the window back there, and I was like, what is... And then he comes over here. Whatever.
It's different.
It's all good.
Alright.
Okay. And I have to do this without reading off of the paper, so this is gonna be fun.
Maybe
You can
read it out loud.
Okay.
On paper. And
So I will
correct.
read it a few times,
Yeah,
and then
exactly.
hopefully I can memorize it.
Right at the camera this time.
All right. My name is Dr. Stephanie Rudderbush. I am a family practice physician with Munson Healthcare OMH Medical Group, Lewiston. My God, that is hard to say.
Hey, but you know it.
I do, but holy crap, that's
Yeah.
just like blah.
Yeah. And smile.
I'll try to smile.
Yeah, don't concentrate.
Yeah.
Concentrate too hard. What am I trying to say? Okay. My name is Stephanie Rudderbush. I'm a family practice physician with Munson Healthcare OMH Medical Group, Lewiston. That wasn't very good at the end.
That was
That
impressive.
was still good.
I remembered everything, I
For
think.
first
Make
shot,
sure you
man.
say Dr. Stephanie Rutherford.
Oh, yeah.
Yeah,
That might be a slightly important part.
whatever, right?
Eh. Okay. My name is Dr. Stephanie Rudderbush. I am a family practice physician with Munson Healthcare OMH, Lewiston. And I forgot medical group. So,
And I want you to smile at the end if you can.
okay. Can do that. My name is Dr. Stephanie Rudderbush. I'm a family practice physician with Munson Healthcare OMH Medical Group, Lewiston.
That's a mouthful.
That is
I stumbled.
terrible.
That is
So
such a
bad.
mouthful. They really need to, like, not have the name be so freaking long.
Let's.
But I know it was like a community vote, so it's never going to change.
Could we just say OMH?
Yeah,
Group
yeah.
Lewiston?
We'll do one more with,
Take out
and
Munson.
we'll do one more at the full, and then we'll take out Munson Healthcare.
Yeah, we'll see what happens.
Yeah.
It'll be fine.
Yeah.
All right. My name is Dr. Stephanie Rudderbush. I'm a family practice physician with Munson Healthcare OMH Medical Group, Lewiston. That didn't work.
So bad.
All right. My name is Dr. Stephanie Rudderbush. I'm a family practice physician with Munson Healthcare Medical Group, OMH.
This
Nope.
is always the
Nope.
hardest.
Don't. Yeah.
Ah.
You're good.
All right. Stare at it for a second. Burn it into my eyes. So that way I know what it says. Okay. My name is Dr. Stephanie Rudderbush. I'm a family practice physician with Munson Healthcare OMH Medical Group, Lewiston.
She got the smile.
And this-
Hopefully I didn't look like I was concentrating too much.
Thoughts?
Can we do one without the Munson Healthcare?
Sure.
OMH Medical
Always
Group
nice
Lewiston.
to do.
I can do that.
All right.
My name is Dr. Stephanie Rudderbush. I'm a family practice physician with OMH Medical Group, Lewiston.
Much nicer, yeah. I mean,
It's
you
so
did
much
great,
less of
yeah.
a mouthful than the other one. The Munson Healthcare thing just makes it sound dumb. Couldn't it just be like Munson OMH? Nope.
Nope.
Had to be Munson Healthcare.
I was born at Munson Hospital.
Yeah, right.
Well, before it was a medical center, Munson Hospital, yes, I was.
Great job.
Cool.
All right.
You
Mhm.